Hey, future counselor. In order to pass your addiction counselor exam, you must have a clear understanding of co-occurring disorders. That's when someone has both a mental health diagnosis and a substance use diagnosis at the same time. Today, we're going to go through 51 practice questions, all on co-occurring topics. This is going to help you improve your counseling skills, your clinical reasoning, and professional ethics, three major content areas on any addiction counselor exam. If you're new here, welcome. I'm Letitia, a licensed professional counselor and a licensed substance abuse treatment practitioner. I provide mental health and substance use education and trainings. I also help future counselors like you study smarter so you can pass your exams with confidence. So now that we're study partners, let's get started. As addiction counselors, when we treat someone with a co-occurring disorder, they have both a substance use diagnosis and a mental health diagnosis. This is happening at the same time. One doesn't exist without the other, and each condition can affect the other and sometimes even worsen or hide the symptoms of the other diagnosis. In addiction counseling, this really matters because treatment can't be one-sided. If you only focus on the substance use issue and ignore the mental health issue, outcomes usually suffer. Co-occurring disorders affect things like engagement, relapse, treatment, and even safety. This is why every major addiction counseling exams addresses co-occurring disorders in some type of way. So whether you're taking the NCAC1, the NCAC2, the MAC, the ADC, or the AADC, they all include this concept in one way or another. On exams, co-occurring disorder questions often show up as scenarios. They might ask you how to treat one, which you already know we don't treat one, we treat both, and we also treat them at the same time. So as we start our practice questions, always remember those 2 points. They exist at the same time, they must be treated at the same time, and you cannot treat one without the other. A client with bipolar disorder and cannabis use disorder reports stopping mood stabilizers because marijuana keeps me level. What is the most appropriate clinical response? Provide psychoeducation about the risk of cannabis use in bipolar disorder and encourage medication compliance. Explore the client's perceived benefits of marijuana use while assessing insight, risk, and readiness for change. Refer the client to a higher level of care for substance use treatment before continuing therapy, or instruct the client to resume prescribed medication in order to continue counseling services. The correct answer is B. Explore the client's perceived benefits of marijuana use while assessing insight, risk, and readiness for change. B is the best answer because asking about why marijuana feels helpful builds trust and lets you understand the client's thinking, risks, and readiness for change. A is not the best answer because teaching right away can make clients shut down or it doesn't help you understand their reasons first. C is not the best answer because sending the client to treatment without fully assessing the situation is jumping ahead too fast. And D is not the best answer because counselors don't tell clients to change medications. That is not our scope of practice. That is the role of a medical prescriber. So this question is tricky because two answers sound good. As a matter of fact, all of them can be quote unquote right. But the best answer would be B. You want to make sure you build rapport first and get as much accurate information as possible so you can make the most safe decision. Which assessment finding most strongly suggests the need for integrated co-occurring treatment? Substance use occurs only on weekends. Mental health symptoms predate substance use. Substance use increases during mood instability, or the client denies having a substance use problem. The correct answer is C. Substance use increases during mood instability. C is correct because if we're able to link the symptoms to the use, it suggests that the disorders interact and they must be treated together. A is incorrect because frequency alone does not indicate a co-occurring disorder or that they have both a mental health and substance use condition. B is incorrect because timing alone can't determine treatment. And D is incorrect because denial also can't determine a treatment model. On the exam, make sure you're looking for how disorders and symptoms interact, not just history or if the client is denying a problem. A client with PTSD uses alcohol nightly for sleep. Which clinical focus is most appropriate early in treatment? Immediate trauma processing, alcohol abstinence as the sole goal, skill building for sleep and regulation, or referral to an inpatient detox? The correct answer is C, skill building for sleep and regulation. C is correct because stabilizing a client and teaching skills can address both PTSD symptoms and substance use symptoms. A is incorrect because trauma processing too early can harm the client. B is incorrect because focusing only on abstinence or pressuring the client to stop altogether will ignore why they're coping and why they're using to cope. And D is incorrect because there's no indication of medical withdrawal. So many clinicians want to treat the trauma first. We want to hop right in, especially if we're trauma informed. But when you're taking your exams, really read the questions and always think about safety first and stabilizing first. And especially with co-occurring questions, pick the one that's the safest, the most ethical, but treats the symptoms together. Which statement best reflects recovery-oriented care for clients with co-occurring disorders? Treatment should prioritize symptom stabilization before encouraging client autonomy. Recovery requires consistent structure and firm boundaries to prevent regression. Recovery is a collaborative, person-driven process that may include setbacks, or treatment effectiveness is measured primarily by sustained abstinence. The correct answer is C. Recovery is a collaborative, person-driven process that may include setbacks. C is the best answer because this uses the core recovery principles: collaboration, person-centered care, and acceptance of progress. Progress that isn't linear. A is incorrect because it sounds clinical, but it prioritizes clinician control over client autonomy. B is incorrect because structure matters, but this frames recovery as something that's imposed on the client rather than developed and built with the client. And D is incorrect because this is a common exam trap. The outcome measurement can include abstinence, but recovery-oriented models emphasize quality of life, functioning, empowerment, and engagement, not just stopping the use. A client with schizophrenia acknowledges that stimulant use worsens their hallucinations, but states, "I'm not sure I want to stop using yet." What is the most important assessment priority at this time? Readiness for substance use treatment, medication adherence and symptom severity, peer influence on substance use, or legal consequences of use? The correct answer is A, readiness for substance use treatment. A is correct because the client is unsure about changing, and at this stage, the clinical priority is to assess them for readiness, motivation, and their ability to change. B is incorrect because this is important clinically, but the question is asking about assessment priority. C is incorrect because peer influence matters later in treatment, but in planning is not the primary assessment focus right now. And D is incorrect because legal issues may be relevant, but they do not guide clinical engagement or immediate treatment direction. When documenting a co-occurring assessment, which statement best demonstrates clinical reasoning? Client reports no concern about substance use. Client meets DSM-5 criteria for multiple diagnosis. Substance use appears functionally related to emotional regulation deficits and increases during distress, or client was engaged and cooperative throughout the session. The correct answer is C. Substance use appears functionally related to emotional regulation deficits and increases during distress. C is correct because it shows clinical reasoning. It includes how you interpret, how you are recognizing patterns, and how you're putting all that data together. A is incorrect because this is just raw client data. It's not clinical reasoning. B is incorrect because diagnosing or having a diagnostic identification alone is clinical classification, but it does not show reasoning. And D is incorrect because this is a behavioral observation, not an analysis. A counselor suspects co-occurring depression in a client who attributes symptoms to substance use. The client also reports persistent hopelessness, impaired functioning, and passive thoughts of not wanting to wake up. What is the most appropriate clinical response? Accept the client's explanation and avoid diagnosis. Diagnose depression immediately to ensure treatment access. Continue assessment over time while monitoring symptoms, or refer immediately for psychiatric evaluation. The correct answer is D. Refer immediately for psychiatric evaluation. D is correct because this addresses both safety and you can get a diagnostic clarification. A is incorrect because this answer would neglect safety and clinical responsibility. B is incorrect because you don't want to prematurely diagnose without a psychiatric eval or a medical eval. And C is incorrect because monitoring is not enough when there are risks present. Remember, the client said she's having thoughts, she reported other symptoms, so you would be better safe and support the client with scheduling a psychiatric evaluation. Which treatment approach is most supported for co-occurring disorders? Integrated treatment, parallel but separate treatment, sequential treatment, or crisis-only intervention? The correct answer is A, integrated treatment. A is correct because integrated treatment addresses both conditions at the same time. B is incorrect because lack of coordination can reduce the effectiveness of treatment. C is incorrect because treating one condition at a time can increase relapse risk. And D is incorrect because ongoing treatment is usually required. A client with anxiety disorder and opioid use disorder reports fear of stopping use due to panic symptoms. What should treatment planning most prioritize? Begin structured exposure work to reduce avoidance and fear response. Initiate medication-assisted treatment as the primary intervention. Integrate anxiety regulation skills with substance use treatment. Or establish a behavioral contract requiring abstinence to reduce risk. The correct answer is C. Integrate anxiety regulation skills with substance use treatment. C is correct because it reflects integrated co-occurring treatment, treating both conditions together, addressing the function, and helping them to build coping skills. A is incorrect because exposure can be helpful, but jumping straight to exposure without stabilizing can worsen symptoms. B is incorrect because medication management is evidence-based and important, but MAT alone ignores the anxiety. And remember, you want to address both. And D is incorrect because behavioral contracts can be used, but they don't address the anxiety issue. Which factor most increases relapse risk for clients with co-occurring disorders? Limited insight, fragmented treatment, prior treatment history, or family involvement? The correct answer is B, fragmented treatment services. B is correct because uncoordinated care leads to gaps and inconsistent interventions and messaging. A is incorrect because insight can improve over time. C is incorrect because prior treatment does not predict relapse alone. And D is incorrect because family involvement is often a protective factor. A client with bipolar disorder and stimulant use disorder reports stopping mood stabilizers because they feel flat, but continue stimulant use to feel productive. What should the counselor address first? Reinforce medication compliance, explore the client's experience of medication effects, focus on abstinence from stimulants, or refer the client back to psychiatry immediately. The correct answer is B, explore the client's experience of medication effects. B is correct because exploring the client's perception of medication helps you build rapport and informs how you will coordinate the treatment moving forward. A is incorrect because insisting on compliance without understanding the client's experiences and needs can increase resistance. C is incorrect because focusing only on substance use ignores the mental health side and the co-occurring mood disorder. D is incorrect because a referral may be appropriate later, but understanding concerns will come first. A client reports daily cannabis use and chronic anxiety. The client states the cannabis helps me sleep. What is the most appropriate assessment response? Validate cannabis use as a coping strategy. Assess anxiety symptoms independent of substance use. Recommend immediate cessation of cannabis, or attribute anxiety symptoms primarily to cannabis use. The correct answer is B. Assess anxiety symptoms independent of substance use. B is correct because separating mental health and substance use symptoms in the assessment helps your case for co-occurring disorder. Remember, you want to treat them together, but when you're assessing, you want it to be clear that they have both. A is incorrect because validation without assessment risks reinforcing the use. C is incorrect because helping them to immediately stop may increase anxiety and they may disengage after that. And D is incorrect because assumptions without the assessment may reduce accuracy. During assessment, a client minimizes alcohol use but reports multiple panic attacks following drinking. What should the counselor consider most? Panic disorder as the primary diagnosis, alcohol-induced anxiety symptoms, client defensiveness, or inaccurate self-report. The correct answer is B, alcohol-induced anxiety symptoms. B is correct because panic symptoms occurring after use suggest substance-induced anxiety. A is incorrect because timing suggests a substance-related component. C is incorrect because minimizing alone does not explain the symptom pattern. And D is incorrect because partial insight does not equal full inaccuracy. A client with trauma history and opioid use disorder becomes emotionally dysregulated during assessment. What is the best clinical response? Continue assessment to gather complete data. Pause and apply grounding techniques. Redirect to substance use questions only, or end the session and reschedule. The correct answer is B, pause and apply grounding strategies. B is correct because you're supporting the client with regulating, so it supports safety so you can have a reliable assessment. Now, when I first constructed this question, I was like, I know they're going to think that you should just reschedule or immediately send them out. But remember, the word is dysregulation. So, a little nervousness, a little overwhelm. So you want to support them with becoming, more relaxed and addressing the dysregulation so you can move forward with the assessment. It didn't say panic attack. It didn't say anxiety attack. It didn't say any medical life-threatening issue. Okay, so I just want to be clear. A is incorrect because continuing may increase distress and reduce accuracy. So you don't want to continue without addressing the dysregulation. C is incorrect because avoiding trauma ignores the co-occurring presentation. And D is incorrect because immediate termination may feel rejecting. So you want to make sure that you're efficient and you don't want to conflict with trauma-informed care. So you want to address all the things, but make sure the client is safe. A client presents with depressive symptoms that improve during periods of abstinence. What does this most suggest? Major depressive disorder, adjustment disorder, substance-induced depressive symptoms, or persistent depressive disorder? The correct answer is substance-induced depressive symptoms. C is correct because mood improvement during abstinence suggests substance-induced symptoms. So if the improvement happens when they are not using, it has to be drug or substance related. A is incorrect because symptoms resolve without abstinence. B is incorrect because symptoms are substance linked rather than situational. And D is incorrect because persistence across time is not demonstrated. Which assessment finding most supports a co-occurring diagnosis rather than substance-induced symptoms? Symptoms begin after substance use escalated. Symptoms occur only during intoxication. Symptoms predate substance use, or symptoms worsen during withdrawal. The correct answer is C. Symptoms predate substance use. C is correct because if they were experiencing mental health symptoms or were struggling before they started using, this would support a diagnosis of a co-occurring disorder. They were having mental health problems outside of using. A is incorrect because timing suggests substance influence. B is incorrect because intoxication only symptoms are substance related. So that would mean that supports more just a substance use issue. D is incorrect because withdrawal effects can mimic psychiatric symptoms. So remember, when they are suggesting anything about co-occurring disorder, you have to be able to identify the substance use issue and the mental health issue separately. And then if they ask you something about treatment, you treat them together at the same time. A client with schizophrenia uses alcohol to reduce auditory hallucinations. What is the most important assessment consideration? Alcohol is functioning as self-medication. Hallucinations are likely alcohol-induced. Alcohol use should be addressed after stabilization, or psychosis invalidates substance use assessment. The correct answer is A. Alcohol is functioning as self-medication. A is correct because identifying self-medication patterns informs integrated care. B is incorrect because hallucinations happen before the substance use. C is incorrect because delaying substance use assessments can miss a critical interaction. And D is incorrect because both conditions must be assessed together. Which documentation practice best reflects co-occurring assessment standards? Listing substance use and mental health diagnosis separately, prioritizing the most severe diagnosis only, describing symptom interaction and functional impact, or deferring diagnosis until abstinence is achieved. The correct answer is C, describing symptom interaction and functional impairment. C is correct because interaction and function guide treatment planning. A is incorrect because separation ignores the interaction. Remember, coexisting together. B is incorrect because co-occurring care does not have a hierarchy. One is not more important than the other. And D is incorrect because assessment occurs even when the abstinence is not present. So they don't have to stop or be completely abstinent in order for you to assess them. A client denies suicidal ideation but reports heavy substance use during periods of emotional numbness. What should the counselor assess next? Protective factors only, past suicide attempts, motivation for abstinence, or legal consequences of use? The correct answer is B, past suicide attempts. B is correct because history of attempts is a strong risk indicator. So you have the part where they admit use. Now you have to assess the mental health part in order to make a solid case for a co-occurring diagnosis. A is incorrect because risk assessment must be comprehensive. C is incorrect because safety takes precedence over motivation. And D is incorrect because legal issues are secondary when it comes to risk assessment. When assessing a client for ADHD and stimulant misuse, which distinction is most important? Whether stimulants improve focus, whether misuse occurs outside prescribed parameters, whether ADHD symptoms are severe, or whether the client prefers non-medication options. The correct answer is B, whether misuse occurs outside prescribed parameters. B is correct because using outside of the prescribed parameters would be defined as misuse. A is incorrect because benefit does not determine misuse. C is incorrect because the severity alone does not determine diagnosis. And D is incorrect because preference does not define a disorder. You can't diagnose them off preference. A counselor suspects both PTSD and substance use disorder but lacks full information. What is the most appropriate diagnostic approach? Assign both diagnoses immediately, delay all diagnosis until treatment progresses, use provisional diagnosis with ongoing assessment, or diagnose only the substance use disorder. The correct answer is C, use provisional diagnosis with ongoing treatment. C is correct because providing a provisional or temporary diagnosis reflects clinical uncertainty while allowing treatment. A is incorrect because certainty is not established. B is incorrect because assessment and diagnosis guide the care and the treatment planning. We need that. And D is incorrect because ignoring trauma reduces the effectiveness of treatment. So we don't know it all. As addiction professionals, counselors, clinicians, you can have a provisional diagnosis. You are documenting, hey, this is the information I have. I'm going to continue to assess and work on getting more information. That is the most ethical, and that's what good clinical providers do. As we're working through it, we don't just say, oh, we don't have all the information, let's just not treat the client. We want to make sure we treat them. But if you don't have all the information or you don't have full, accurate information, use what you have, but document. It's okay to be uncertain and start the treatment. And then as you go, you can add more information. So that is what a provisional diagnosis is. A client with long-term alcohol use reports chronic anxiety symptoms that predated substance use and continued during sustained periods of abstinence. What is the most appropriate next step? Focus treatment on substance use and reassess anxiety later. Refer the client for a mental health evaluation. Attribute anxiety to protracted withdrawal, or initiate relapse prevention planning only. The correct answer is B. Refer the client for a mental health evaluation. B is correct because symptoms that happen before use and they continue even when they stop points towards a mental health condition, and you want to get that evaluated so you can get that co-occurring disorder diagnosis. A is incorrect because persistent symptoms during abstinence suggest more than substance-related anxiety. C is incorrect because protracted withdrawal would not explain symptoms that existed before they started using. And D is incorrect because relapse prevention alone does not address untreated co-occurring symptoms. During assessment, a client reports using opioids to manage emotional numbness following trauma. Which interpretation best reflects co-occurring clinical reasoning? The substance use is the primary disorder. Trauma symptoms are unrelated to substance use. Substance use may function as emotional regulation, or the client is minimizing opioid dependence. The correct answer is C. Substance use may function as emotional regulation. So they're using the substance to cope. C is correct because substances, drugs, alcohol, misused substances are often used to manage trauma-related emotional distress. A is incorrect because the relationship between trauma and use requires exploration, not assumption. So if you are leaning towards co-occurring disorder, you have to address both. You can't assume and you can't ignore. B is incorrect because trauma and substance use often interact. And D is incorrect because no evidence suggests minimization at this stage. So it didn't say anything about the client making their symptoms or behaviors smaller than what they are. Correct answer is C. A counselor suspects co-occurring depression but is unsure whether symptoms are substance-induced. What assessment strategy is most appropriate? Delay diagnosis until long-term abstinence is achieved. Diagnose depression immediately to avoid risk. Gather longitudinal history and symptom patterns, or rely solely on screening tools results. The correct answer is C. Gather longitudinal history and symptom patterns. C is correct because gathering information about the pattern of use over time helps you tell the difference between substance-induced and other symptoms that are separate from their use. A is incorrect because waiting indefinitely delays treatment planning. We don't want to delay. B is incorrect because diagnosing too soon may be inaccurate, so you don't want to rush it. And D is incorrect because screening tools support but do not replace clinical judgment. A client with schizophrenia reports daily cannabis use. Which clinical concern is most relevant? Cannabis may worsen psychotic symptoms. Cannabis use typically reduces anxiety and psychosis. Substance use is secondary and not clinically relevant. Or psychotic symptoms prevent substance use treatment. The correct answer is cannabis may worsen psychotic symptoms. A is correct because cannabis use is associated with increasing psychotic and psychiatric symptoms. B is incorrect because perceived short-term relief does not reflect clinical risk. C is incorrect because substance use can affect psychiatric stability. And D is incorrect because co-occurring treatment is both possible and recommended. During assessment, a client reports using substances primarily to manage emotional distress but minimizes mental health symptoms. What is the most appropriate clinical response? Focus substance use treatment before addressing emotional concerns. Document substance use only to avoid diagnostic confusion. Explore emotional symptoms while continuing substance use assessment. Or delay mental health discussion until abstinence is achieved. The correct answer is C. Explore emotional symptoms while continuing substance use assessment. C is correct because co-occurring assessment involves exploring emotional symptoms at the same time you explore substance use symptoms. A is incorrect because separating substance use from emotional factors may miss key points of why they're using. B is incorrect because limiting assessment reduces the clinical accuracy, so you want to address all components. And D is incorrect because waiting for abstinence can delay appropriate intervention. A client engaged in treatment reports improvement in mood but increased substance cravings. What does this most likely suggest? Substance use disorder is resolving. Mental health symptoms are misdiagnosed. Treatment focus may need adjustment, or the client is exaggerating symptoms. The correct answer is C. Treatment focus may need adjustment. C is correct because shifts in symptoms may signal that the treatment needs to be adjusted. It happens with improvement when the client declines. A treatment plan is an ongoing document. Treatment is always ongoing and they may need to be refocused as the client improves. A is incorrect because increased cravings suggest ongoing substance use related needs. B is incorrect because mood improvement does not invalidate the earlier assessment. And D is incorrect because symptom changes are common during treatment. Remember, progress is always going to be up, down. It's going to be a squiggly line, not a line straight down, not a line straight up. There'll be ebbs and flows, and you'll adjust treatment as needed. Which documentation practice best supports integrated treatment planning for co-occurring disorders? A separate note for mental health and substance use concerns, narrative summaries linking symptoms, behaviors, and use patterns, brief progress notes focus on attendance, or diagnostic labels without supporting context. The correct answer is B, narrative summaries linking symptoms, behaviors, and patterns. B is correct because integrated narratives show how symptoms and substance use interact over time. A is incorrect because separating documentation can fragment care and it can be confusing. Remember, this is a living document. Other providers may have access to it. So you want to make sure you're clear and that the care is integrated and ongoing. C is incorrect because attendance alone does not reflect clinical progress. And D is incorrect because a diagnosis is required with support to guide treatment. A client denies mental health concerns but reports repeated substance use during periods of stress. What should the counselor do next? Accept the client's denial and avoid further exploration. Confront the client about lack of insight. Provide psychoeducation and continue monitoring patterns. Or diagnose a mental health disorder based on use patterns. The correct answer is C. Provide psychoeducation and continue monitoring patterns. C is correct because education and observation support insight without forcing conclusions. A is incorrect because avoiding limits assessment accuracy. B is incorrect because confronting them may reduce engagement and rapport. And D is incorrect because a diagnosis requires sufficient clinical evidence. Which factor most increases the complexity of treating co-occurring disorders? Client age, use of standardized screening tools, interaction between symptoms and substance use, or length of treatment history? The correct answer is C, interaction between symptoms and substance use. C is correct because understanding the interactions between symptoms and the substances that the client uses, you will have more information on how it influences their presentation, risk, and how they respond to treatment. A is incorrect because age alone does not determine complexity. B is incorrect because screening tools generally support assessment. And D is incorrect because longer treatment history does not mean that the treatment will be more complex. A counselor is completing an assessment with a client who reports increased substance use during periods of emotional numbness rather than emotional distress. Which interpretation is most clinically appropriate? Substance use is primarily recreational. Substance use may function as emotional regulation. Emotional numbness indicates low clinical risk, or the client lacks insight into substance use patterns. The correct answer is B. Substance use may function as emotional regulation. B is correct because clients may use substances and other drugs to manage or alter their emotional states, including numbness. A is incorrect because use patterns tied to emotional states suggest that it's more than recreational. C is incorrect because emotional numbness can be associated with trauma or depression. And D is incorrect because the client demonstrated self-awareness of these patterns. During assessment, a client reports stopping prescribed medication when using substances due to unwanted side effects. What is the counselor's best next step? Advise the client to discontinue substances immediately. Encourage the client to resume medication as prescribed. Explore the client's experience and coordinate with prescriber. Or document non-compliance and proceed with substance treatment. The correct answer is C. Explore the client's experience and coordinate with prescriber. C is correct because coordination supports safety and integrated care. A is incorrect because directive advice without assessment may reduce engagement. B is incorrect because medication changes require a prescriber involvement. That is not our scope of practice. And D is incorrect because documentation alone does not address risk. Which assessment finding most strongly supports the presence of co-occurring disorder rather than substance-induced symptoms? Symptoms emerge only during periods of intoxication. Symptoms persist during sustained abstinence. Family reports recent behavioral changes, or the client reports distress related to symptoms. The correct answer is B. Symptoms persist during sustained abstinence. B is correct because persistence beyond substance use suggests that there's another condition, there's a mental health thing going on. A is incorrect because substance-induced symptoms often resolve when you stop using the substance. C is incorrect because behavior change alone does not clarify the cause. And D is incorrect because distress can occur in both scenarios. A counselor notices a client minimizes substance use while emphasizing mental health symptoms. Which approach best supports accurate assessment? Challenge the client's minimization directly. Focus assessment exclusively on mental health symptoms. Use open-ended questions and reflective listening. Or delay assessment until trust is fully established. The correct answer is C. Use open-ended questions and reflective listening. C is correct because collaborative interviewing improves what they disclose. A is incorrect because confrontation may increase defensiveness. B is incorrect because both domains must be assessed. And D is incorrect because assessment can proceed while building rapport at the same time. A client reports using substances to manage intrusive memories but denies craving outside these episodes. How should this information be interpreted? Substance use is situational rather than problematic. Craving is absent, reducing risk of dependence. Trauma symptoms may be driving substance use. or substance use and trauma are unrelated. The correct answer is C. Trauma symptoms may be driving substance use. C is correct because substances are being used to cope with trauma symptoms. A is incorrect because situational use can still be clinically significant. B is incorrect because cravings can present in different forms. And D is incorrect because the client identified a clear connection. When assessing readiness for change in a client with co-occurring disorders, which factor is most important to evaluate? Length of substance use history, severity of psychiatric diagnosis, client's perception of how substance use affects functioning, or number of prior treatment episodes. The correct answer is C. Client's perception of how substance use affects functioning. C is correct because perceived impact influences engagement and change. A is incorrect because history alone does not indicate their readiness. B is incorrect because a diagnosis does not predict motivation or the severity of their diagnosis. And D is incorrect because prior treatment does not determine their readiness. A counselor documents that a client experiences panic symptoms and increased substance use, but avoids diagnosing during assessment. What is the primary reason for this approach? Diagnosis is outside the counselor's scope. Assessment focuses on information gathering, not conclusions. Diagnosis requires multiple sessions to confirm, or substance use invalidates mental health symptoms. The correct answer is B. Assessment focuses on information gathering, not conclusions. B is correct because the assessment aims to gather as much information as possible, accurate information, before drawing conclusions. A is incorrect because diagnosis may fall within the scope depending on the clinician's license. C is incorrect because timing alone is not the primary reason. And D is incorrect because co-occurring symptoms remain clinically relevant. Which assessment practice best reduces the risk of diagnostic overshadowing in co-occurring cases? Prioritizing substance use concerns, prioritizing mental health symptoms, assessing both domains concurrently, or assigning provisional diagnosis early. The correct answer is C, assessing both domains concurrently. C is correct because assessing concurrently supports accuracy. A is incorrect because focusing on one area, you can miss other areas. B is incorrect for the same reason. It must be simultaneously integrated, concurrent. And D is incorrect because early labeling may limit exploration. A client reports multiple stressors, intermittent substance use, and inconsistent sleep. Which approach best supports differential assessment? Identify the most severe symptom and treat first. Explore symptom timing, duration, and context. Assume symptoms are stress-related. Or focus assessment on substance frequency. The correct answer is B. Explore symptom timing, duration, and context. B is correct because timing and context support differential assessment. A is incorrect because severity alone does not clarify cause. C is incorrect because assumptions reduce the accuracy of your assessment. And D is incorrect because frequency alone is insufficient. When summarizing assessment findings for a client with possible co-occurring disorders, which documentation practice is most appropriate? Listing diagnosis without supporting evidence, using definitive language to clarify conclusions, describing patterns, concerns, and next steps, or limiting documentation to substance use history. The correct answer is C, describing patterns, concerns, and next steps. C is correct because it reflects clinical reasoning and planning. A is incorrect because diagnosis requires justification. B is incorrect because assessment findings may remain tentative. And D is incorrect because it takes out key mental health information. A counselor is assessing a client with both substance use and trauma-related symptoms. Which action best supports accurate assessment? Focusing primarily on trauma to avoid reinforcing substance use. Using screening tools intermittently across multiple sessions. Completing all assessments in the first session. or deferring substance-related questions until abstinence is achieved. The correct answer is B, using screening tools intermittently across multiple sessions. B is correct because assessment is an ongoing process and repeated screening helps clarify symptom patterns over time. A is incorrect because focusing only on one concern may overlook how symptoms interact. C is incorrect because comprehensive assessment often unfolds gradually as rapport develops. And D is incorrect because substance use information is relevant regardless of abstinence status. During assessment, a client reports using substances to manage emotional distress. What should the counselor prioritize next? Determining whether the substance use meets diagnostic criteria, exploring the function of substance use within the client's coping system, advising immediate cessation of substance use, or referring the client for medication management. The correct answer is B, exploring the function of substance use within the client's coping system. B is correct because understanding function supports accurate case conceptualization and treatment planning. A is incorrect because diagnosis alone does not guide effective intervention. C is incorrect because advice without assessment may increase resistance. And D is incorrect because referral decisions should follow a clearer understanding of the client's needs. A client presents with overlapping symptoms that could reflect anxiety, withdrawal, or trauma. What is the most appropriate assessment approach? Assigning a provisional diagnosis and monitoring symptom changes, selecting the diagnosis that appears most severe, treating symptoms as substance-induced until proven otherwise, or avoiding diagnostic decisions until symptoms resolve. The correct answer is A, assigning a provisional diagnosis and monitoring symptom changes. A is correct because provisional diagnosis allows flexibility as new information emerges. B is incorrect because severity alone does not determine diagnostic accuracy. C is incorrect because assuming substance causation may overlook co-occurring conditions. And D is incorrect because some diagnostic guidance is needed to support care planning. Which documentation practice best supports ethical care for clients with co-occurring disorders? Recording only confirmed diagnosis, using clinical impressions without referencing client reports, clearly distinguishing observed behaviors from client self-report, or limiting documentation to substance use details. The correct answer is C, clearly distinguishing observed behaviors from client self-report. C is correct because separating observation from report improves clarity and accuracy. A is incorrect because assessments often involve evolving information. B is incorrect because client perspective is clinically relevant. And D is incorrect because co-occurring care requires a broader clinical picture. A counselor notices that a client's mental health symptoms intensify during periods of reduced substance use. What should this indicate clinically? The substance use was the primary disorder. The symptoms are unrelated to substance use. Further assessment is needed to clarify symptom origins. The client is not ready for integrated treatment. The correct answer is C. Further assessment is needed to clarify symptom origins. C is correct because changes during reduction often reveal underlying conditions. A is incorrect because symptom emergence during reduction does not confirm causation. B is incorrect because symptom patterns may still be connected. And D is incorrect because readiness is not determined only by how the symptoms show up. When assessing readiness for change in clients with co-occurring disorders, the counselor should focus most on compliance with treatment recommendations, insight into diagnostic labels, willingness to engage in at least one area of care, or length of time symptoms have been present. The correct answer is C, willingness to engage in at least one area of care. C is correct because engagement in any area can support overall progress. A is incorrect because compliance may go up and down across domains. It just depends. B is incorrect because insight varies and may evolve over time. And D is incorrect because duration alone does not indicate their readiness. A counselor is determining the level of care for a client with co-occurring symptoms. Which factor should carry the most weight? presence of multiple diagnoses, impact of symptoms on daily functioning, client preference for outpatient care, or previous treatment history. The correct answer is B, impact of symptoms on daily functioning. B is correct because functional impairment guides intensity decisions. A is incorrect because diagnosis count does not determine care needs. C is incorrect because preference must be balanced with clinical judgment. And D is incorrect because history informs but does not outweigh current functioning. A client minimizes substance use but reports frequent emotional dysregulation. What is the most appropriate assessment response? Challenging the client's perception of substance use, accepting the report and documenting no substance concern, exploring discrepancies without confrontation, or referring immediately for substance use treatment. The correct answer is C, exploring discrepancies without confrontation. C is correct because asking gentle questions supports engagement and accuracy. A is incorrect because confrontation may damage rapport. B is incorrect because minimizing is common and it warrants exploration. D is incorrect because referral decisions require fuller assessment. Which assessment practice best reduces diagnostic overshadowing in co-occurring cases? Prioritizing the disorder that prompted referral, assessing each condition independently and collaboratively, assigning diagnosis sequentially, or limiting assessment tools to reduce client burden. The correct answer is B, assessing each condition independently and collaboratively. B is correct because parallel assessment prevents one condition from overshadowing another. A is incorrect because referral reasons may not reflect full needs. C is incorrect because sequencing may delay appropriate care. And D is incorrect because limited tools may reduce the accuracy of your assessment. When evaluating risk in clients with co-occurring disorders, the counselor should consider substance use patterns alone, mental health symptoms in isolation, interaction between symptoms and environmental stressors, or diagnostic history only. The correct answer is C, interaction between symptoms and environmental stressors. C is correct because combined factors shape real-world risk. A is incorrect because substance use occurs within broader contexts. B is incorrect because symptoms often interact with each other. And D is incorrect because past diagnoses do not capture the current risk alone. A counselor is unsure whether symptoms are substance-induced or indicative of a co-occurring condition. What is the most appropriate next step? Delay treatment until diagnostic clarity is achieved. Refer the client to multiple providers immediately. Document uncertainty and continue integrated assessment. Or select the diagnosis most commonly associated with the substance. The correct answer is C, document uncertainty and continue integrated assessment. C is correct because transparency and continued assessment supports ethical care. A is incorrect because treatment should not be withheld due to uncertainty. B is incorrect because referrals should be purposeful and coordinated. And D is incorrect because assumptions reduce the diagnostic accuracy. The most important thing to remember in co-occurring disorders is both mental health and substance use issues must be treated at the same time. On the exam, the safest and most effective answer is usually going to be the one that supports integrated care. If these questions were helpful, check the description for more practice videos and the 100 question practice test that I created to help you study smarter. And be sure to subscribe so you never miss a weekly exam prep video. You've got this. I'll see you soon.